today what we're going to do is we're going to demo the bite registration. These are the supplies you have. Over off to the side, we're using the JetBite brand for the bite registration. Total time is 1 minute and 35 seconds. Working time is 35 seconds. Setting time is 1 minute. As we discussed in class, this is your extruder gun with the cartridge. Okay, we talked about how there's a switch in the back. You pull back, here it is right here. Okay, push back and then pull back. Okay, then to load it, there's a little V, a little divot, and a little spot there. It's almost like the male and the female part. Place it in, you close it, push back on your little button in the back, engage. Okay, and then what you're going to do is you're going to bleed part of just a little bit at the beginning of each procedure. You bleed just a little, as you can see, there it is. Okay, I'm going to then close it for purposes for right now. There's a little V here which you probably can't see, but I'll try to show you, and a little V on this side. It's the male and the female part. Again, you put it in, you push down, and you turn. The reason why I'm closing it is because I want to show you that this is important. That after you bleed it, you want to cover this, because you do not want this to get on your clothes. You don't want it to get on your patient's clothes either, and that's why a lot of times you'll see that the doctor will place a plastic apron over the patient when they're using the Aquaseal. Any type of impression material will stain the clothes. Okay. All right. So I've already bled it. I've closed it again. It's engaged. However, I'm going to go ahead and remove it. Remove the tip. Do not throw this away. Put it off to the side. You take your tip. You notice that the cap is pink, so the tip is also color-coded pink, so you know that this is the right amount, this is the right size and tip recommended by the manufacturer. Again, there's a little V there, a little divot, and the insert over here. It's that male and female part. Place it in, match it up, place it, push it, and then turn it. You want to make sure that you actually turn this, because if you don't turn it and lock it, when you go to extrude, it's going to just go and explode everywhere. Okay, so now that part is ready. I've already prepped my room. Now I'll be using my Typodont as my mannequin. When you go to discuss this with your Typodont, you always with your patient. Okay, I have to practice there. I have to go through all the litany of equipment that we use. Okay, with a patient, you would lower your mask so they can hear you give instructions, because sometimes patients are hard of hearing and they need to be able to hear you. Okay, or sometimes they have to read your lips, so you need to enunciate and they need to be able to see your lips. Okay, so always remember to pull your mask down when you give instructions, and then you would put it back up. Okay, all right, so you would talk to the patient. You say, well, hi, thank you, we're going to do a procedure, we're going to take a bite registration. All it is a material that we'll place on top of your teeth, okay, and then have you bite down and hold down for 1 minute. You want to make sure not to use words that they may not understand, like occlusal on your mandibular and things like that. Okay, and after you do that, you just say it's just on top. You bite down for 1 minute. We'll hold it. Okay, so then you ask them, of course, have you ever had this done before? Yes. Oh, so you know the procedure. Okay. If not, then you proceed into that part of explaining what you're going to do. Okay. Then you ask them to bite down, and bite down like they normally bite, and smile for you. Because what you want to do is you want to make sure that they're biting down. You want to be able to see how they normally bite. You want to be able to then look at the canine. That's the tooth I usually prefer to look at. If they don't have a canine, then look at a premolar. But what you're trying to do is see where it's going to actually match up when they bite down. Where is it going to land between the two teeth on the bottom? If they're biting down and it's off like this, then you know they're not biting down correctly, because you've already seen how they normally bite, because bit down and they smiled for you, okay? Very important step, because remember, if we don't get a good bite registration, then it's going to throw off the final impression that we send and the opposing model that we send to the lab, okay? All right, so I have everything I need. I've given my instructions. I have 35 seconds on the timer. Now again, remember, do not take your gun and drag it like this on the tooth, because it will pull the material off, okay? Again, I said I prefer to, go at an angle because it doesn't pull the material. You go at an angle and you let it fall and you zigzag a little bit. And I go all the way, all the time, cranking this, because if not, it won't come out. Cranking, and I prefer to stop right here at this canine premolar because there's more of an occlusal area there. And I wipe it down, and then I start again in the back, and I keep going, and I cross over just a little, and that's it, and then I have them bite down, okay? After you have done this, if you miss a piece, do not go back and add, because if you go back and add, this part on this side that you first started already started to harden. So it's not going to be the same, and then when they go bite down like they normally bite, they won't be able to bite down all the way because of the fact that it's two different materials at two different settings, okay? So you only have 35 seconds to do it, okay? So I will proceed to do it, and hopefully it's recording, okay? If you press the yellow button for me, please. Okay, so. Okay, go down. I have them bite down. I'll lift it up so you can see it. I have them bite down and hold. Okay, so you can see where it's at there, how it's biting down. I had 5 seconds still to go. Notice that there's still a little bit on the tip. You want to leave that tip there. Now what I'm going to do is put it on timer 2 and then start the set time. I finished a couple of seconds earlier because of the size of the mouth, so I'll just go straight into doing that. Okay, there's a little bit on this part. I leave it there so I can test it. Remember, it'll always set faster in the mouth because of the heat than it will out here. Technically, I could have started the timer right away because I had finished, but a couple of seconds isn't going to hurt if you leave it in a little longer. What you want to make sure is that they're actually biting down, okay? Now, while I'm holding this, just a little FYI, if you accidentally in an office throw this tip away, well, don't put your hand in the trash and start looking for it and all that stuff. You can always leave this one on there, but you need to really disinfect it. You won't use it on the patient's mouth because you can't use it, but all you're using it for really is just to make sure, thank you, just to make sure that it doesn't dry out the material, but you would disinfect it and everything else. Okay, so now it's been a minute. Now, I want to say lots of times it's the patient struggles to open and they panic. Don't worry, that just means you got really good. Okay, so you have them open up. You can see the impression there. Okay, you can see that. Hopefully you're seeing it in the video here. Hopefully, here that you have the occlusal. You got the top. Now on one of these, on the maxillary, I do have a crown prep, so it wouldn't have touched it there, just maybe just a little. Okay, see? Just a little right there. But all this here is what's important. Okay? Then when you take it out, you flip it over, and you can see the opposite side. It's a little thin right here, and it's actually before I got to my cutoff. So see, the incisal edge is always so hard, okay, to make sure. This one's a little thicker on that one, okay? So then you would make sure to take care of your patient, clean them up, little wet gauze if they got anything on their mouth and stuff, okay? Take care of them. then you would then go back and rinse this with water and disinfect it. Okay, then you would stick it in the cold sterile. Okay, before you do that though, you would take your Sharpie and you would put the patient's initials somewhere where there's a little extra space to put it. So if it were for someone, I'd put, say I would use my initials, but let's say it was for Afsoon, okay? So then I would go in there and put A-R. So then when I pull it out of the cold sterile and I rinse it and I package it and get it ready to send to the lab, I now know that I have the correct bite registration to send with the model. Of course, you always double check it by trying it in, making sure there wasn't a second AF that came in that day, okay?